And we don't know if Parkinson's disease played any role in Williams' decision to commit suicide. We do know he battled depression and bipolar. And our health expert, Dr. Kevin Campbell, is here. Good morning, Dr.
Good
Campbell.
morning.
Always a pleasure to have you. Tell us about depression and bipolar.
So depression is a very, very common ailment in the U.S. today, as is bipolar disorder. And unfortunately, it's really not gotten a lot of press until something bad and tragic like this happens. Bipolar disorder is periods of low sadness, depression, but also periods of mania where you feel on top of the world. And the issue with that is when you're in a manic phase, sometimes you don't take your medicines, and that can lead to a very deep rebound depression.
Right, and the combination of the two, wow,
It's, you may have several swings with mood a year, and these can be devastating to family, jobs, relationships, and all sorts of things like that.
You're a heart surgeon. Tell us, what is there's a correlation between heart surgery and also depression. How does that work?
Well, it's interesting. Mr. Williams, at age 58, actually had open heart surgery. He had one valve repaired and one valve replaced. Big traumatic event. And what we know is in people who've had heart surgery, post-operatively, depression occurs in about 40% of them. And for the most part, if you have any predisposing conditions like bipolar disorder, like substance abuse, it can put you at even higher risk. Did this contribute to Mr. Williams' suicide? It might have played a role. I think that it is more common than we think.
And what can we do to help prevent depression in heart patients?
I think as healthcare providers, we have to be vigilant. We have to not only worry about the mechanical things we do for the patient, we have to worry about their emotional health as well. And I think that family members, nursing staff, and doctors all play a role in that.
Depression is such a very serious and real disease. Tell us, what is the bottom line for all of us here?
I think that we need to make sure that we always look out for our family members, our coworkers, and others. If you see any signs of depression, or if anyone voices suicidal ideations, get them help. There's a national suicide hotline that we're going to have on our website today. I think that Mr. Williams was a very wonderful, generous man, and I think that he would want to help others. And I think maybe his legacy will be that he drew attention to this very dark, sad illness so that others don't suffer the same fate.
Yeah, I definitely agree with that. We'll have that hotline number on our website. And do you have a medical question for Dr. Campbell? Ask him. It's easy. Just log onto our website to WNCN.com. Search links we mentioned. From there, you can find Dr. Campbell's website, or you can like his Facebook page and Twitter. Thank you.